Did you know that 1 in 4 deaths in the United States are related to heart disease? And that also 1 in 5 people had a heart attack and they didn't even know it. Around 80% of cardiovascular disease factors are preventable, according to the CDC, because there are around 200 deaths, 200,000 deaths here in the United States that are heart disease related that could be prevented. That's a huge, huge number. So that's what we're going to talk about here today is about cardiovascular disease because it is Heart Awareness Month. And for Heart Awareness Month, our office here, we are offering a free heart health screening. Every February we do this where we offer an EKG as well as an ankle brachial index, looking, of course, at vitals and blood pressure to bring about awareness to this very important topic, which is heart disease for Heart Awareness Month. So when a lot of people, when they think of cardiovascular disease and they think about prevention, the main thing that comes up, think about heart disease prevention is, of course, cholesterol. So cholesterol medications is kind of the front line of prevention for heart disease. But there are certainly some problems with just relying on cholesterol medication. First, there's an understanding that within the plaquing in your arteries, there is, of course, cholesterol. So, and there are a lot of studies that are also show that if you bring your cholesterol levels down, that may be of value for helping to decrease cardiovascular disease. I don't know if you ever heard of the number needed to treat, a statistic called the NNT. The NNT is a statistic that looks at how many patients have to actually be treated in order for one person to actually gain any kind of benefit from a particular medication. So for instance, if the NNT is 100, that would mean that 100 people would have to be treated with a certain medication in order for one person to gain any kind of benefit from that particular medication. Well, according to the recent studies, around 217 people have to be treated with a cholesterol medication in order for them to have any benefit or reduction of them having a heart attack. That's 217 people have to be treated in order for one person to gain any kind of benefit to prevent a heart attack. Around 313 people have to be treated with statin medications in order for one person to actually to avoid a stroke. Now, if you look at, so that the NNT for heart attack is 217 and the for a stroke, avoiding a stroke, is 313 when you look at statin medications. Well, when we look at antibiotics, what is the NNT for an antibiotic and preventing a sinus infection? That number is 17. 17. Only 17 people need to take an antibiotic in order for one person, just one person, to get benefit from an antibiotic. So it's quite a number of people that have to be treated with a statin medication for even one person to gain any kind of benefit from those medications. But the NNT on the other side of that is how many people have to be treated with a statin medication before they actually have a symptom, a side effect. Well, the NNT for statin medications and it's causing actually experiencing pain or muscle damage, the NNT is 21. So 21 people take the statin medication, and it takes only 21 people for one person to have a side effect of pain or muscle damage from statin medications. We know that statin medications also can or contribute to even foggy thinking. Because why? Because cholesterol, the reduction of cholesterol, it can affect lots of different things in your body. Your brain, of course, has cholesterols in them, so it can affect cognitive function. We know that there's side effects regarding, of course, pain and inflammation in the muscles and those things as well. So we know there are side effects from medications because cholesterols are important. Cholesterols affect your sex hormones because testosterone and estrogen, progesterone, those all are made of cholesterol as well. So taking cholesterol medications, it's not necessarily I'm saying that you shouldn't take any cholesterol medications, but it is an important thing to note is that the front line of defense for heart disease prevention in this country with cholesterol medication, well, the NNT is fairly high, and also the side effects or number of people that are going to experience side effects is somewhat high as well. And that's unfortunate. And that's unfortunate also that our main line defense for preventing heart disease is actually cholesterol meds, when we know that we should be taking an aggressive prevention stance with regards to preventing heart disease. Aggressive prevention doesn't necessarily just mean taking a medication. Perhaps due to your genetics and those things, maybe that's something you should do. You should speak to your provider about that. But remember this, that there are some people that have a 300 cholesterol their entire life and they never have heart disease. And there are some people that have 150 cholesterol and they're having heart stents being put in 2 times a year. There's something more going on than just cholesterol. That's something that we all have to come to the reality is that that's true. That cholesterol is involved in the entire body. You need that. And that there's more to cardiovascular health than just cholesterol. So obviously there's studies about exercise and also a diet, of course, that can positively impact cardiovascular disease outcomes. If you look at the omega-3 fatty acids, multitude of studies about that, the fish oils, if you may, that those who are not consuming enough fish oils, that they have an increased risk of blood pressure problems and heart disease problems, also triglyceride problems, all kinds of things there. And we have seen routinely that those who end up changing their fatty acid profiles, and you can test that, by the way, you can test your fatty acid profiles and see whether or not your omega-3s are too low, your fish oils are too low, or your omega-6s are too high. And when people address their omega-6-3 ratios, their cholesterol numbers naturally change for the better without taking any medications. So it's important that we realize that. Also, we have to realize that, as I said before, that just because you have 300 cholesterol doesn't mean it's necessarily dangerous. And the more recent studies in looking at what's the true risk of cholesterol comes from your lipoprotein fractioning or your cholesterol particle sizes. Because again, some people, they think they have awesome cholesterol and it's not that great because their cholesterol particle sizes are very, very, very small and increase their risk of having plaquing in their arteries because their particle sizes are small. Well, you can actually test that. Some people who are told you need to take a statin medication for preventative reasons, and you find out that their particle sizes are actually perfectly fine. Well, not to test is to guess, to test is to know. So you can actually test and you can look at that. You can find out. It is true that genetics are also related to cardiovascular disease. Has anybody ever heard of the mummy studies? So the mummy studies where they look in antiquity and look at the mummies and they see that cardiovascular disease has been present in humans for a very, very, very long time. And so, yes, definitely it's true that cardiovascular disease is present, and genetics definitely are also a good part of why some individuals have an increased risk of cardiovascular disease. But most certainly there are things that we can do. So we go back again to that CDC statistic showing that around 80% of cardiovascular disease has some kind of preventable factor related to it that you and I have an impact on. And like I said, just the omega-3s, I mean, that's just one of them. How about the refined foods, the processed foods? Studies of British Medical Journal, they've come out here in recent times showing that if for every 10% increase of your highly processed foods, that would be like your chips and crackers and soda and those kinds of foods, any of those highly processed foods, for every 10% increase, you also increase your risk of cardiovascular disease and coronary disease, also stroke, aneurysm, all those things by around 10 to 15% for every 10% that you increase of processed foods. Those processed foods are not food, right? They're just not. So every time that you go and grab a soda pop, that's not food. Every time you go and grab a potato chip bag, something like that, that's not really food. And you are increasing the risk of inflammation and plaquing and destruction of your arteries by consuming those things because they are not food. Refined sugar, And just highly processed sugars as well. Just that's not good. Raising your insulin levels up increases inflammation in your arteries. And we have seen time and time and time again, when you address the insulin status in your body, decreasing your A1C and your blood sugar status, bring that into normal ranges, you can see that triglycerides will reduce naturally. You can see also that inflammatory markers such as SED rate and C-reactive protein, that those decrease naturally, and the person just has more energy. They just feel better. And of course, their predisposition towards cardiovascular disease improves, their improved outcomes, because they've addressed the overall inflammatory status of their body and decreasing the sugar load on their bodies as well. Preventing cardiovascular disease is not just about quitting smoking. It's not just about stopping consuming alcohol. It's not just about taking cholesterol medications. Aggressive prevention is taking a science-based, aggressive approach at actually looking at the causes of the inflammation that are inside the arteries that create plaquing to begin with. And there are a variety of things you can do to get your body healthier than it was the day before by giving your body what it needs and taking away what it doesn't need. Perhaps you are low in magnesium. The CDC acknowledges that many people do have low magnesium. Perhaps you're low in vitamin D. The CDC acknowledges that lots of people are low in vitamin D. Perhaps you're low in omega-3 fatty acids. The CDC acknowledges that there are lots of people who are low in the omega-3 fatty acids. We could go on and on and on, but there's lots of people who are deficient and low in nutrients. Nobody is deficient in a statin medication. Are you giving your body what you need? Do you know? Well, you can test. For this month, for February, come in and schedule a time for our free heart health screening, where we're going to do an EKG, also an ABI index, an ankle brachial index with a Doppler ultrasound, look at your blood pressure and give you some good information on that. And any way we can help you out, we'd love to help you out. So give our office a call, area code 402-463-4257. Murray Natural Integrated Health, setting the standard in natural health care. Take care. Have a blessed day.